This is BrainSTEM with your host, Neuroscientist Dr. Hilary Marusak, production by Amanpreet Manmeet Bhogal. Luke, thank you so much for joining us. I very much appreciate it. Can you just start by briefly introducing yourself?
Hi, thanks for having me here, Hilary. My name is Luke Hyde. I'm an associate professor of psychology at the University of Michigan.
Awesome. So can you start by defining some terms for us for this special episode? We're talking about antisocial behaviors today, but can you talk about how that relates to things like antisocial personality disorder, sociopathy, psychopathy, callous unemotional traits?
Yeah, sure. It's kind of a crazy web of words out there. So I would say I broadly study something that I call antisocial behavior and people in the field call. And we don't mean like people with autism or people who don't like other people, which sometimes people think that's what I mean. We mean people who do something the opposite of pro-social behavior. Pro-social behavior is being kind to each other, being nice, being empathetic. So antisocial behavior means doing behaviors that are violating the rights of other people. So we usually mean things like aggression, so fighting or violence, and rule breaking. And that's kind of a broad umbrella term. Some people include substance use in there. I don't personally. Often people who are involved in antisocial behavior do use substances, but there are other diagnoses for folks who are having trouble with substances. So we study antisocial behavior broadly, but the psychiatric manuals that define disorders in adulthood give a diagnosis of something called antisocial personality disorder if you're involved in really high levels and sort of a lifelong history of crime. So this means from the time you were young to the time you're an adult, you've been involved in pretty serious antisocial behavior. In children, we diagnose antisocial behavior with something called conduct disorder. And again, that's sort of a diagnosis that has to do with doing a lot of behaviors that have to do with breaking rules, breaking the law. And those are the real diagnoses that are out there in something called the Diagnostic and Statistics Manual, which is what defines psychiatric disorders in the US. But a lot of people are really fascinated by psychopathy, which they've heard a lot about. And interestingly, psychopathy is not in that diagnostic manual. It's been separate from that diagnostic manual, never included in the diagnostic manual, at least not as it's conceptualized now. And it can be tested for in several ways, but it's defined often by a measure called the psychopathy checklist. And it's in adults, and it's essentially antisocial personality disorder plus a bunch of personality traits that are not so great, like being callous, having low empathy towards others, being manipulative and conning, so generally exploiting other people. That's diagnosed mostly just in adults. And in children, people have started in the last 20 or 30 years studying something called callous unemotional traits. And those measure parts of psychopathy. So it's just some of that personality that we see in adults high on psychopathy. And it's really kind of looking at callousness towards others, low empathy, not having really deep emotions or using your emotions to manipulate other people. And one thing that I always want to make sure people understand is that callous and emotional traits, which we measure in kids, are a risk factor for psychopathy. That is, it doesn't mean we're studying child psychopaths. We don't think any children can be psychopaths, but we're studying traits that put them at risk for later psychopathy. So I think that's important. The same way that many kids will have conduct disorder, and most of those kids will not have antisocial personality disorder. More kids will have callous and emotional traits, and most of them will not go on to qualify for a diagnosis of psychopathy.
Mm-hmm. Yeah, so I can see why people get confused by all of these traits. So you've got like the childhood version, the adulthood version, and then you've got this personality disorder aspect as well. Very interesting. Thank you for clarifying. How common are these behaviors, and are there any sex differences?
So conduct disorder can be as frequent as up to 10% of the population in youth. It's higher among boys by a fair amount, although it depends on the age. And antisocial personality disorder is lower than that, maybe 4 or 5%. It's hard to know what the estimates of psychopathy are because it takes a pretty intensive interview to diagnose folks with. But in prison settings, they've estimated the rate is around 40%. In prison settings. So that means, again, most people in prison are not psychopaths or high on psychopathy, but there's a substantial portion of people that are. And studies are still kind of coming out on the rate of callous and emotional traits, but maybe of the um, kids with conduct disorder, maybe something in the 40% range might have callous and emotional
Wow.
traits.
Okay. And you mentioned that these things begin very early in life, a lot of cases, and it doesn't necessarily mean that they will develop something like antisocial personality disorder, but this is why your research and a lot of other folks' research focuses on childhood and adolescence. So what do we know about like when these behaviors start to begin?
Yeah, that's a great question. It's a sort of a complex answer, which is that the trends and when kids have these behaviors actually matters a lot in terms of how long it might last. So some really important research about 20 or 30 years ago showed that there's sort of two groups of kids that can get involved in antisocial behaviors. Some that start early, that is, they start by the time they're 2 or 3, they're already higher on aggression. They have sort of the terrible twos, but it's worse and it sort of doesn't get a lot better, and that's maybe 4% of the population. And often many of those kids will continue to have lifelong struggles. But then a big portion of the population will kind of dabble with antisocial behavior as teenagers. And if you think back to when you were in high school or adolescent, there are a lot of kids who are trying out things. They might try stealing things from a store, or try using drugs, or get into more fights. And that tends to be more transient. Kids do get into some kids at that age that get involved do get onto longer trajectories of antisocial behaviors, often if they get ensnared by, say, the legal system. That's not evenly distributed. So lower income youth and youth of color are more likely to get ensnared in the legal system, even if they're just sort of trying these things out. But it's mostly the kids who start early who tend to go on to the longer histories of antisocial behavior. But the opposite is also true. Many kids have behavior problems early on. I have a 4 and a 6-year-old at home, and I can tell you they both had plenty of temper tantrums when they were 2 and 3. It's really normal for kids. It's the most aggressive period of life to be fighting and biting and things like that when you're, in preschool and early elementary school. So the hard thing for us is figuring out who's not going to get better over time and who's going to have this sort of long-term trajectory that we'd want to intervene with.
And like a lot of research on mental disorders, it looks like you really do need to track people over long periods of time in so-called longitudinal research, which I know you've been involved with as well, to really get those complex patterns. Very interesting.
Absolutely, yeah.
I wanted to ask you, so like a lot of our listeners, I'm sure, I like learning about the minds of psychopaths, like serial killers, other violent offenders. I think it's really, really fascinating. So what is it that's different in their neurodevelopment that makes them to have these tendencies and produce these behaviors? Can you talk about what is known about kind of the neurobiology of antisocial behaviors?
Yeah, sure. So I think the first thing that's important to establish too is that psychopathy is based on people's behaviors and some of their personality traits, but not necessarily like the crimes or offenses that they have. So a lot of people are really fascinated by serial killers. Many serial killers are not psychopaths. Many psychopaths are not serial killers, and many psychopaths are not even murderers. So it has much more to do with sort of like your pattern of personality and behavior rather than the offense that you might get arrested for or be in trouble for. And there has been some research on murderers and serial killers, but those are kind of small groups of folks. And so much more has been done either on folks high in psychopathy in prisons, or kids with conduct disorder, or kids with conduct disorder and antisocial behavior. And what we know so far, what we think we know, and we're always learning more every day, is that kids with antisocial behavior broadly seem to have trouble with inhibition, that is like stopping themselves from doing something that they want to do right now. So if you see something you want to grab just because you're curious, you might stop yourself and say, that's like a hot stove, I shouldn't do that. And these folks are more impulsive. They also tend to have trouble with rewards. So they really like the rewards. And then once something is rewarding, they might keep doing it, even if there are punishments that happen. So you could think of offending, right? You might break the law and get in trouble, but have trouble stopping yourself from continuing to do that thing. And then they have trouble understanding the emotions of others and sort of feeling the emotions of others. And so those sort of three components, having trouble with inhibition, reward, and emotions of others, are sort of the way we think about the kind of core traits behind antisocial behavior, and then the brain systems that support them. So we and many other people are finding differences in brain function and structure in areas of the brain that sort of support stopping yourself from doing things that you shouldn't do, your how much you value rewards, and then how much you process the emotions of others and regulate your own emotions. In adult psychopaths, there's a theory that sort of some of the core problems are in the amygdala, which is a part of your brain that processes what's threatening, what you should be paying attention to, but also emotions and others. And the orbital frontal cortex, which is the part right here above your eyes that helps sort of stop you from doing things. It helps regulate your emotions. It also helps sort of calculate values of things. And so there are some theories that psychopathy, among a bunch of other areas, that those two brain areas may be really key to understanding psychopathy.
It's super interesting because we know that a lot of those brain areas you described that are responsible for kind of inhibiting a response, like you're at a store and you want to take something, but you're like, no, I can't just steal it. Those brain areas like the prefrontal cortex develop across, the first 2 decades of life. So it makes sense with what you mentioned earlier that a lot of teens will kind of dabble with these behaviors while those brain systems are sort of maturing.
Yeah, absolutely.
Yeah. And your research focuses on understanding kind of risk and resilience factors. As you mentioned, like who's going to continue to have these behaviors over time, the role of the environment per se, or for example. So can you talk about genetics and environment and how they play a role in risk for these behaviors?
Yeah, that's a good question. It's complex again because we sort of study these two different groups of kids, those that have antisocial behavior and then those that have antisocial behavior and have callous emotional traits. And they seem to have slightly different, um, the genes seem to matter in slightly different ways. So for kids with just sort of like normal antisocial behavior that don't also have these callous emotional traits or are less risk for psychopathy, genetics do play a role, but it's not a super big role. But we know that some of the biggest risk factors for antisocial behavior include things like concentrated disadvantage and poverty. So, having harsh parents, living in a more dangerous neighborhood. So, sort of all the things we can think of that stack up against lower income families tend to be, unfortunately, risk factors for getting involved in antisocial behavior. Um, and there's definitely interactions between genes and those experiences, such that some kids are at greater risk. Maybe their parents have been more involved in antisocial behavior. They pass on some of that risk, and then they might live in an environment where there's more risk. For kids with callous and emotional traits, we think that genes play a bigger role, not the whole story, but a little bit bigger of a role. And so we think those kids' genes matter more, but then that interacts with the environment. And we're still learning more about the environment. There have been some studies by my lab and several others that have looked at harsh parenting or a lack of warm parenting as risk factors for callous emotional traits, especially for kids who are genetically at risk, or the kind of converse that kids who are genetically at risk, if they have really warm parents, might be able to sort of knock out that genetic risk. So I think with many, psychiatric disorders and complex traits, it's not just nature or nurture; it's sort of the interaction of the two.
Absolutely. Yeah, that definitely seems to be the story that it's not as simple as we think. And even with a lot of the brain areas you mentioned, it could be the amygdala, but the amygdala interacting with, a diverse brain network that it's connected to. So all these different areas are interconnected. So we certainly have a, a tough problem in our job, but a lot of work left to be done. What types of treatments or interventions are there, if there are any, for these types of behaviors?
Yeah, we think about treatments and interventions sort of developmentally because, like you said, this is really something that looks different at each age. In really early childhood, we might think of preventative interventions, that is, like ones that we would target to families who are at risk. Like, so for example, at age 2, we don't know who's going to go on to have who's going to go on to not have continued terrible twos. So we might target families who are more at risk. And in preschool period, there are several really good empirically supported treatments for kids with behavior problems. One is called parent management training or parent training. And this isn't, if it might sound to parents like this is telling parents what to do, but what it really is saying is you have a kid who might be a little more challenging than other kids, and we can kind of teach you some extra tricks to help sculpt their behavior in a way that might prevent some of the behaviors that are tough to deal with. And it involves a lot of sort of positive parenting techniques. There's another kind of intervention that's pretty similar called PCIT, which is parent-child interaction therapy. It's pretty similar, but one of the cool things about that one is you put in an earbud and the parent and child play together while the therapist is in another room watching, and they kind of give some coaching tips to the parent as they go. So those are really good in preschool and school age. There are bigger programs that involve the same kinds of training called like the Incredible Years or Triple P, which are actually in some countries everyone can get that, or elementary schools broadly use. In the U.S., that's not quite as widely available, but if parents are interested, they could Google the Incredible Years. Um, and then as kids get older, when they're in adolescence, unfortunately, often antisocial behavior is not taken to mental health professionals. Often the folks who are intervening there are like the legal system and the police. But one of the parent management training can still be helpful then. And then another treatment that has a lot of research behind it is something called multisystemic therapy, which involves parenting, but also engaging a lot of community supports to help kids sort of change their behavior. So there are good empirically supported treatments for kids. There's also family therapy options at that age. In adulthood, we just don't know as much because our country really thinks that we should punish, and so we put people in the jail where they don't really get any treatment, not even for other mental health issues. And we know that actually putting together people that also have antisocial behavior tends to do something called peer contagion. That is, you learn from your peers other bad behaviors. And so it tends to actually make people worse, tends to make their mental health worse generally, and put them with other people where they might learn more worse antisocial behavior, as well as break up the positive relationships they have, work, things like that. So we know less. There are studies ongoing right now that show promise for helping folks, but in our country, as long as we're mostly just putting people in prison and punishing them without treatment, we're not likely to actually prevent a lot of the antisocial behavior that we see in adults.
Right. And what are you most excited about in this area, in your research and treatment and intervention?
I'm really excited about sort of treatment studies, not that we're doing, but that I hope one day we are doing. I think two different kinds of treatment studies. One is figuring out treatments that can scale up really large so that everyone has opportunities to get them. So right now, when I was in graduate school, we were doing a preventative intervention with families who were higher risk because they were living in more dangerous neighborhoods and they had less resources. But those are families often that can't get to treatment providers. They can't just take off work and take their kid 30 minutes to cross town to find the best therapist and do one-on-one therapy. And so we did in-home interventions with families and kind of came to them and helped them. And so I'm really excited about some studies that are going on now that help intervene or prevent with families from the start. So there are interventions called like nurse home visitation programs that help pregnant parents from the start and in the first year of life, and then can sometimes transition to sort of someone you can check in with. So I'm excited about that because I think those have really broader health, public health impacts. And then the other kinds of treatments I'm excited about are personalized treatments for kids with callous and emotional traits who tend to have worse antisocial behavior, and so they need sort of extra effective interventions. And there are some trials going on now where folks are trying to target specific issues for kids with callous and emotional traits to try to make those interventions more effective and help them from potentially becoming more antisocial as they go on.
And like a lot of kind of psychiatric research, it looks like folks are moving earlier to intervene, like you said, because that can have maximal impact versus, like you said, when they already interact with the legal system, there's not much that's being done currently. So putting the emphasis earlier in life, I think, is really a way to get a bigger bang for the buck.
Absolutely. I think unfortunately things kind of go downhill that, as kids get older, you can undermine their relationship with their parents, they get involved, they drop out of school. There's lots of things that happen. So the earlier we can work with kids and families and communities, the
Awesome.
better.
So before we wrap up, I wanted to address some common misconceptions, and you did already hit on one of my questions, which was that there's this idea out there that the people with these types of behaviors are all violent, they're full, the jails are just full of them. Is there any truth to that? Are there any other misconceptions you want to raise?
Sure, yeah. So all murderers are not psychopaths. All people who have done, heinous murders that seem terrible are not necessarily psychopaths. And many psychopaths, people high in psychopathy, are not murdering or doing violent crime. I think one misconception people have is that if we know something about the brain of people high in psychopathy, that means it's sort of like, a bad seed, you were born with it. But we know a lot of the work that we're doing in my lab now is showing that experiences like parenting and the resources you have actually shape your brain over time. Our brain is really plastic. It changes all the time. And so just because we learn about differences in the brain between people with antisocial behavior, people high on psychopathy, doesn't mean that we can't change it with treatment, doesn't mean that the people are destined to be this way always, and doesn't mean that it's genetic either. Sometimes our brain is sculpted by the environment. And even if something's genetic, even if we found something's 100% genetic, which it never will be, or we found one gene, doesn't mean we can't intervene with it. You can't see on the screen, but I'm pretty tall, and that certainly has a lot to do with genes. Hilary knows that 'cause she's seen me in person. It has to do with genes, but if I was fed really poorly or really well, that will impact my height too. And that's one of the most heritable, most genetic things we know is height, and yet the environment has a huge effect on that. Our better nutrition over decades has made us all taller. So I just want to kind of hit those misconceptions that just because something is genetic doesn't mean we can't change it, doesn't mean we can't treat it, and doesn't mean we shouldn't. And then I think the other thing is just our idea in our country that punishment is the best approach. We know from decades of psychological research that punishment is not super effective if it's not also with, effective treatments. So if we really wanted to decrease crime, I'm not saying we shouldn't put people in jail or prison or there shouldn't be consequences for people's actions, but we really need to think much more about treatment and prevention if we want to decrease crime and things.
That's a wonderful message. Thank you for clarifying those. I want to end with resources, and you already mentioned a couple excellent resources, and we will link to that in the bio of the podcast, but what would you recommend for parents or caregivers who think their child may have some of these behaviors you described, or even for adults who themselves may think that they or a partner, for example, have these behaviors?
Yeah, so you'll have a link for the Aftermath Society for people who are partners and are worried about that, which can be helpful for links. For parents, there's going to be a link to the CDC website that has an everyday parenting curriculum, which is actually one you can do online. It's free. It has lots of science and evidence-based practices. And if that's not enough, or that's just a start, or you'd rather meet with someone, then you can Google parent management training and a therapist near you. I think the biggest thing that I try to teach students here at Michigan, or when I talk to families, is that we don't have a system in the country where all mental health providers believe in evidence-based practice. That is, they don't always provide practices that have been supported by science. And so what you really want to do is look for a child psychologist or social worker or some other sort of therapist and ask them what sort of science the intervention they have behind it. And often the best thing to do is ask for parent training and parent management training. That's a very standard intervention. It's very effective. And many professionals know it. So I think that's an important thing to be sort of an educated consumer.
That's great. I haven't heard that advice yet. I'm gonna use that a lot to really ask what kind of science-based treatments they use, because you're exactly right. Not all kind of mental health professionals are created equal. And a lot of folks will just go to like their general practitioner and try to get psychiatric help. And it really is good to go to a specialist who uses, as you say, evidence-based treatments.
Yeah, it shouldn't be an opaque process. We don't believe anymore in sort of lying on a couch with your back away from the therapist and them sort of doing some sort of voodoo to your head. You should go in and talk to the mental health provider and ask them what the diagnosis is, what the treatment is, why they'd recommend that treatment versus another treatment. The same way you would if you broke your arm or you needed a knee surgery. You'd go in and ask what the diagnosis is and what the options are and what the science is behind them. And I would encourage folks to do that for any mental health, any mental illness that they're seeking help for.
Very helpful. Thank you so much, Luke. And thank you so much again for your time, Dr. Hyde. I very much appreciate it.
Yeah, thanks for having me and glad to be here.
That wraps up another episode of the BrainSTEM podcast. Thank you so much for listening. Please subscribe and share this with friends and family, and be sure to follow us on social media at BrainSTEM Podcast.